CDC issued its strongest guidance yesterday, urging pregnant women to be vaccinated against COVID-19. As Gabe Gutierrez explains, the guidance comes as more than 250,000 cases of coronavirus in pregnant women have been reported.
The CDC says that for pregnant women, getting the vaccine is critical. It's the strongest guidance to date from the agency on the subject, and it comes as the vaccine remains a flashpoint amid new mandates and mounting misinformation. Now, the CDC's new data shows that symptomatic pregnant women have more than a twofold increased risk of ICU admission and a 70% higher risk of death than sick COVID patients who aren't pregnant. According to the CDC, 161 pregnant women have died of COVID, with 22 deaths in August alone. The agency also warning COVID can increase the risk of issues surrounding birth, including preterm birth, stillbirth, and admission of infants to the ICU. Right now, only about 1 in 3 pregnant women is vaccinated. This all comes as more companies are trying to enforce vaccine mandates. United Airlines announcing that it's firing nearly 600 employees for refusing to get the shot. But here in New York, the governor says more than 92% of healthcare workers have now gotten at least one shot. Proof, she argues, that the vaccine mandate is working. Gabe Gutierrez, NBC News, New York.
With hospital beds at capacity and staffing stretched thin, the Indiana National Guard is stepping in to help. But good news, the state is starting to see a dip in cases, but that dip won't result in a decline in patients for 2 or 3 weeks. Right now, 4 teams are deployed to assist hospitals around the state, including 15 members at Ascension St. Vincent on 86th Street.
Having this team from the National Guard come in has just really been very helpful. It's provided a respite for that team, certainly a morale boost to see them there. They're eager, jumping in.
So here's how the partnership works. There are 5 teams consisting of usually 10 people, 4 medics and 6 general staff support. They are called the Hospital Crisis Response Team. Now, once a hospital applies, a team will be deployed for 7 to 14 days. This allows hospitals to fill ongoing resources and staffing needs, but it's only for hospitals that have exhausted all other options. And as we mentioned, many hospitals are stretched thin right now. They are currently more than 2,100 people in the hospital statewide with COVID-19. State health leaders say 95% of them are unvaccinated. As our Rich Nye tells us, that's why they're encouraging everyone to roll up their sleeves.
This state health department clinic outside the Indianapolis Motor Speedway is one-stop shopping for COVID. You can get any of the 3 COVID vaccines here. You can get tested for COVID, a rapid test or PCR lab test with results within 48 hours. You can even get a flu shot here.
City Councilor Krista Carlino got a flu shot and a 3rd dose booster of the Pfizer COVID-19 vaccine. She's eligible, working at a high school.
If you're vaccine hesitant, to really reach out, talk to your doctor, dispel some of the myths that are going around. And really, I see it as a civic duty, doing our part, not just to protect ourselves, but to protect one another.
About 44% of eligible Hoosiers have not received any COVID vaccine.
The boosters provide an extra level of protection to our most vulnerable Hoosiers, but the best protection is to get your first dose. Unfortunately, many eligible Hoosiers have not done so as of yet.
About 10,000 shots are going into arms in Indiana every day. But Indiana's chief medical officer says that pace will take another year or longer to reach robust protection for the general population.
And the vaccine clinic continues through Saturday from noon to 8 p.m. each day.